Hello and welcome. You're watching The Big Story here on Mirror Now. I am Afrida Rahman Ali. The convalescent plasma therapy has been now completely dropped from the COVID treatment protocol as per centre's new guidelines. This therapy, which has been widely used in hospitals for treating moderate coronavirus patients, has been dropped from the list of approved treatments for COVID-19 patients in India. This is a big development that has come in. Plasma therapy, viewers would know, is basically a therapy that is based on using antibody-rich plasma from COVID-19 patients who have recovered recently and injecting the plasma to a patient who is in the process of undergoing treatment for COVID-19. That used to be the practice. This is being done away with completely. The ICMR, however, last month had changed its guidelines for plasma therapy, restricting it to moderate cases of COVID-19 and not after 7 days of the onset of symptoms. That was a decision taken only last month. Now there is a further revision of that decision as well that has decided to completely do away with this. The ICMR has dropped it from the COVID-19 management protocol. The decision was unanimous among the members of the ICMR and the National Task Force for COVID-19. So that's the big picture, viewers. This move comes after several scientists wrote to Principal Scientific Advisor K. Vijay Raghavan warning against the irrational and non-scientific use of the procedure in the country. Public health professionals have alleged that plasma therapy was being used rampantly across hospitals despite current research indicating no direct benefit from the procedure. Plasma therapy had been part of the previous guidelines, like I pointed out, but it's been completely weeded out now. It's no longer part of the approved COVID protocol treatment in India. So I'm going to introduce my guests on Big Story today. Dr. Rajiv Dasgupta, Chairperson of the Center of Social Medicine and Community Health from JNU, and also a member of the AEFI committee. Welcome, Dr. Dasgupta. Thanks for joining us. And also Dr. Rajesh M. Parekh, Director, Medical Research of Jaslok Hospital, author of the vaccine book. Dr. Parekh, very good afternoon. Thanks for joining us. And I want to begin by in fact, asking Dr. Dasgupta that, the first question that comes to our minds is, why did it take this long? Why was such a process, such a long drawn one, to understand what is the scientific evidence supporting or not supporting the plasma therapy? And what exactly is the new evidence now, Dr. Dasgupta, that has compelled ICMR to completely remove plasma therapy from the list of approved treatments for COVID-19 in India?
Thank you. The new evidence is the publication of the recovery trial paper in the UK. And if I may read what exactly the findings are, that we did not identify a benefit of convalescent plasma when patients were stratified by time since onset of illness in the main analysis or in an exploratory analysis which subdivided participants on the basis of illness onset. Now, there are 2 points here. One, that overall it did not find any benefit. And secondly, and the reason why the second one is important is because that seems to be the ICMR's contention in hanging on to the plasma therapy, even when ICMR's own evidence was broadly on to the contrary, is that if instituted early enough, this is of some benefit. So the UK recovery trial did not find any evidence of that too. Now, in September, the ICMR's own paper, if I may read, actually went on to say that in settings with limited laboratory capacity, convalescent plasma does not reduce the 28-day mortality or progression to severe disease in in moderately ill, etc., which is exactly the same outcome that the Lancet study was also looking into. And therefore, in September, what was known from the Indian Placid trial was, as one commentator at that point had put it, was half empty and half full. Clearly, the ICMR leaning on the side of the half full rather than the half empty at that point.
Okay, so, right. That's a very interesting point, in fact, Dr. Dasgupta, what you made about how the ICMR wanted to err on the side of caution, perhaps for a long time, allowed this. But now, like you are saying, that multiple international publications also coming forward, that even introducing it in an early stage is not helping. So everything is about data, isn't it, Dr. Parekh? And that is why there's so much reliance on the quantity of data that we have, which helps us understand whether a certain thing is working or not. Do you think there was lack of unanimity earlier? Because, you know, these reports and these kind of findings were there earlier as well. If I recall correctly, international guidelines such as those from US National Institutes of Health, the IDSA guidelines, that much earlier recommended against the use of plasma therapy. So what do you think was the reason that ICMR has taken this long? Was there a lack of unanimity within the medical fraternity, Dr. Parekh? Dr. Parekh, I don't know if you're able to hear me. Okay. Dr. Dasgupta, can I put that question to you? Was there a lack of unanimity within the medical fraternity? Because the moment there is a conflicting opinion, it takes that much longer to build consensus around critical issues like this one.
Well, the timing of it is all very crucial, and understanding the timing issue is important. Now, it is not that plasma therapy or convalescent plasma therapy, to be specific, is a completely new therapy or a new drug. It's nothing of that sort. It's been in practice for nearly 100 years in various viral and related illnesses. The attractiveness of convalescent plasma therapy early in an outbreak, and particularly of a new disease, is that it offers seemingly a ready-made solution to a disease to which we do not have a specific treatment and certainly not a vaccine. Now, this was what drove plasma therapy early on in the pandemic, which means we are talking of April, May, June 2020. And there were multiple trials all over the world at that time, and variously suspended because of different deficits, and certainly many were small, which actually did not make much sense in terms of scientific evidence. And therefore, to the credit of India and the ICMR, it launched the PLACID trial. But then, by the time, as I read out, by the time the results were available in September, and which at that time was certainly one of the largest, well-conducted trials in the world, it certainly did not offer any benefit. So, and just repeat that at the early phase of the pandemic or the epidemic, there is a certain attraction because it provides ready-made antibodies, seemingly, but then it didn't bear the results. Of course, there was some fine print within, which we can discuss, and why, in a sense, this continued possibly.
Yes, that's convincing, Dr. Dasgupta. But again, the question would arise that are we now come to a stage where we have enough data, enough evidence to suggest, like you said earlier also, we have case studies. I mean, you talk to people and you get these inputs about how somebody has recovered after getting a plasma therapy done. And therefore, there was this big rush. In fact, until recently, I mean, you would have people clamoring for plasma therapy in multiple WhatsApp groups. There are systems set in place where a person can get plasma. All of that now, of course, has become redundant. Dr. Parekh is back with us. Dr. Parekh, I was asking you this question on whether, as we go along in our fight against COVID, this is how it is going to be. The more the evidence comes in, the more data comes in, the more streamlined the process of treatment. And this is just one of them, the way plasma therapy has been dropped from the approved treatments.
Well, that's the way it should be. I'm not sure if that's the way it's been all along. I hope you can hear me clearly now.
Okay.
Am I audible?
Yes, I can, Dr. Parekh. Go ahead.
Okay, so I think Dr. Dasgupta gave us an interesting preamble to what has happened so far. Let me just add a bit to it. So when we wrote our first book on the coronavirus in February of 2020, we cautioned against convalescent plasma therapy then saying that there was mixed evidence for its efficacy in SARS, but one should not promote it actively as yet. Now, of course, as Dr. Dasgupta pointed out, the ICMR began a massive trial across the country, which is why I don't understand that caveat that in some circumstances it doesn't work. And I was wondering what was going on, because ordinarily, for most of these studies, the interim results are made public, and those should have been out sometime around July or August. But when the results came out, it was unequivocally clear, in my mind at least, that plasma therapy does not work. And the ICMR said words to that effect, with maybe a minor caveat. There has been ample data across the world to indicate that it just doesn't help. Now, I'll tell you what bothers me. It's not the flip-flop. It's not saying yes, maybe, no. But I think we have to understand this in a larger social context, and perhaps Dr. Dasgupta could amplify on that. We've seen how harrowing an experience it has been for relatives of people to run from pillar to post, trying to get convalescent plasma at a time when it is known all over the world that it doesn't work. So I don't think we can divorce that angle from the data. And when the data is clear, I think this should have happened a long time ago.
Okay, Dr. Dasgupta, would you respond to that? Now, here we have Dr. Parikh suggesting that this was clear long back. I mean, there was ample data long back. There was an inordinate delay in coming to this conclusion. Do you agree with that?
Oh, yes, Dr. Parikh is absolutely right, and I fully agree with him, and we are necessarily echoing each other, if I may. You see, what is really baffling is two things. One, that given that it's a pandemic, given that India emerged as a very high incidence country fairly early on when this trial was being held, it actually meant that it provided a lot of subjects, research subjects, I mean, to have very strong conclusive evidence, which certainly ICMR came with, as Dr. Parikh adequately explained. And therefore, a treatment, even a sort of iffy treatment, one often tries out for a very rare disease. But here is a situation where you have strong evidence, and on the other hand, if you prescribe something, even if it is reasonably strong evidence, and I emphasize even if, one should have the wherewithals to be able to provide it for such very large numbers, and therefore public health decisions come with a dose of pragmatism too. Now, none of these things actually favored the recommendations, which, mind you, the ICMR came up after the results were published. So there are two things coming from ICMR: the data led by the ICMR team and a very large group of investigators, plus the guidelines that followed, which actually had hardly any well-defined caveats, even if there were any caveats at all.
Okay, that's important. Again, like you said, that this has to go through a certain set procedure, and sometimes it becomes inevitable to cover those stages before we make an announcement of this nature. Dr. Parikh also made this point about how we could have saved a lot of stress to a lot of people had we known this or had we announced this much earlier, because we know that because of the second wave and the intensity of it, the plasma therapy again became one of those things that people started clamoring for. Dr. Dasgupta, one more question to you on this, that would it now mean that doctors would be prohibited from prescribing it? It would simply not be allowed, and then of course you will have anxious relatives. There are still many who might still believe in it, going by their experience of other people. So would it take time to really phase it out in that sense?
This is a very important question, and in fact, the Lancet paper actually touches upon it, and it does say that despite the evidence to the contrary, many clinicians still seem to have an unflinching faith in it, and seem to continue with it. The the ministry's guideline does not include plasma therapy anymore, but I'm not really aware whether there is a ban. I mean, whether this word ban is there or not, I'm not aware of it, and it doesn't seem to be so.
Yes. No, because you mentioned earlier that how, on the face of it, it sounds very convincing that patients who have recovered with the antibody-rich plasma,
No,
it sounds like a ready-made
that's
solution, if I
because it's
remember
an
you saying correctly.
no,
So
no.
that's why
Let me not be
people might
misunderstood.
continue to resort to it, is what I was trying to ask you.
No, let me not be misunderstood. One, in the early phase of the pandemic, it offered an attractive solution based on conventional wisdom. One. Second,
Yes.
um,
Yes.
I'm sorry, I
Yes.
missed your question.
No, I was saying that how do we prevent this from being practiced based on individual experiences?
Okay.
And you were saying that, yes, that might be a real challenge.
Yeah, that might be a real challenge because institutions and society indeed has invested too much into it, and it's grown into a conventional wisdom, despite results and Indian trials to the contrary.
Yes. Yes, Dr. Parekh, your views on this as well, that how will we phase this out? And as a medical practitioner, have you come across, you must have, I mean, enough and more examples of patients who rely on these treatments, hoping that their relatives or friends or near and dear ones would get better with plasma therapy?
Well, I have personally been dissuading people for well over a year. Initially, of course, I did tell them, let's await the results of the large ICMR study, and which is why I was a little concerned when the interim results weren't out as they should have been. And, when the results came out, since then I've been dissuading people. But, this is what Bernard Shaw, in another context, of course, said was the triumph of hope over experience. And, it would be amusing were it not for the fact that it is so tragic.
Yes.
Right. A question of whether doctors will be prevented from doing it. In all probability, not. I mean, who prevents a doctor from even, and I'm not by doctor, I mean a self-styled doctor, not necessarily a certified doctor, from prescribing cow urine or cow dung or any one of the things that are being marketed. I see them as ads all over TV, coronal kit and whatever else, none of which has been proven scientifically. Nobody stops you from doing it. So in most countries, and especially in ours, doctors have a fairly wide latitude in terms of what they can prescribe. And unfortunately, that latitude is often used to the detriment of patients particularly, but also of medicine in general.
Yes. So you know why this comes at a time, Dr. Parekh, when we are already, a little confused about the use of remdesivir. It's being said that whether it's effective or not, we don't know. Steroids, the ineffective use of steroids or imprudent use of steroids causing black fungus. So at a time when already there is a lot of doubts and fears and apprehensions around what treatment works and when, you again have plasma therapy also being ruled out. Do you think this is going to also create a lot of anxiety, and how do we dispel that, Dr. Parekh?
Well, it probably will create a lot of anxiety, but the most effective way to dispel anxiety is not to give false hope. If we tell people, oh, this is likely to work, we are allaying their apprehensions for some time, but they come back much more. I think the best way to deal with anxiety is to be transparent in our data. The great medical historian, Harold Merkel, looked at several pandemics through history, and he identified one factor which, caused pandemics to spread as opposed to arresting them. And strangely, it was not a medicine, it was transparency. And he said something to the effect that secrecy has almost always contributed to the spread of pandemics. So I think if we are transparent, the data is out there. And if the data is put forward to the public without censorship, I think people are wise enough, sometimes, of course, guided by their personal physicians, to make these decisions. And I think in the long term, that's the best way, not only to deal with anxiety, but also to deal with the pandemic.
Absolutely correct. Dr. Dasgupta, your thoughts on this as well. With so many now different opinions coming, nothing seems to be concrete on what works as a COVID treatment. We are debating remdesivir use, we are debating use of steroids, and now plasma therapy ruled out. So how are we going to deal with the questions on what then works as COVID treatment at the moment, Dr. Dasgupta?
See, at one level, given that it's a new disease, there will be uncertainties and ongoing uncertainties, if I may, and particularly, for example, now that pediatric cases among children is emerging as a new major category, so there will be ongoing challenges, and therefore that's what the UK did. It actually launched set up this recovery trial, which would factor in the evidence across a range of potential treatments or interventions, and therefore what ought to be included even as a potential treatment also had certain guidelines and parameters, and what would success in a public health setting. But just to come back to the example of whether one will, some institutions or clinicians may still carry on. Let's also recognize that in the UK, particularly in the recovery trial, the plasma therapy was solely led by the National Blood Transfusion Services of the UK, whereas in India, in an extremely fragmented, privately led medical care system, it's been almost an entrepreneurial model, and each trying to outdo the other, if I may.
Yes. Right. So it is one of those fluid situations. It's an evolving situation, and there's a lot of thinking and rethinking and revisiting the effectiveness of certain treatments. Dr. Rajiv Dasgupta, Dr. Rajesh Parekh, appreciate your joining us on The Big Story on Mirror Now today.